Yeah, what's up, everybody? What's going on? It's your man, Mr. Talk 718 with Talk Life, the podcast. Guys, it's been a while. I've been under the weather for a little while. So I've been getting myself together. And I just want to get this last thing out the way. This last video, um, it's not the last video, but it's going to be one of, I have 4 more videos to do on this subject. And then we will be moving on to something else. Okay, what's up? Let me let me post this to Facebook because I want everybody to know what's going on. You know what I mean? I want the world to understand that I'm here for the ladies, and the next thing will be the brothers. But right now, the ladies need the attention. You know, I hope you guys enjoy. Feel free to leave a comment. You know, that's what it's all about. Comments, getting to help each other. That's what I really want to do. What's this? Let's see. Let's see. So I'm having a problem. Oh, okay, okay. Saying it's poor. Streaming health went from excellent, healthy to poor in one shot. I have no idea why. Anyway, let's see what's going on here. All right. All right, folks, what's going on tonight? It's your boy, it's your host, it's your guy, Mr. Talk 718 with Talk Life, the podcast. This is Talk Life TV. This is what it's going to be called. It's going to be called Talk Life TV because actually we're actually able to watch me while I'm talking about the things that I'm talking about as opposed to just the podcast. So I want to welcome you guys to Talk Life with Mr. Talk 718. That would be me. And today's topic is cervical cancer. And when I say I want to talk about things that affects black women, these are the things that disproportionately affecting the black women in America. Can't really discuss what's going on outside the United States because the stats does not talk about other countries. So in America, cervical cancer is actually number 3 on the list of 8. But I didn't want to talk about cancer 2 times in a row, so I went to fibroids and then to cervical cancer. All right. So cervical cancer is a health condition that disproportionately affect black women in the United States. Research published in January in the journal Cancer found that not only are black women more likely to die of cervical cancer than women of other races, they're also 77% more likely to die from it than experts previously thought. Prior estimates said that 5.7% black women per 100,000, that's per capita, would die of the disease. But this new research put the numbers at 10.1% out of 100,000. That's a lot. That's a whole lot. So what I did was I got a picture of cancerous tissue in the cervix, and this is kind of what it looked like. You can see that there is some kind of mutation to the cervix. Unlike breast cancer, cervical cancer is absolutely preventable in the day and age, Dr. Phillips said in 2017. No woman should be diagnosed with cervical cancer. That's partly because the human papillomavirus vaccine is excellent at preventing infections of certain strains of human papillomaviruses. that can go on to cause cancer. So you have some HPVs that can cause cancer. But as of August 2016, only 6 out of 10 girls ages 13 to 17 and 5 of 10 boys in the same age range has started the vaccine series, which doctors recommend getting before age 26 for optimal results. Racial disparities are relevant here, a 2014 report from the CDC, so I get a lot of my information from the CDC, showed that around 71% of white girls 13 to 17 had completed the 3-shot series, compared with about 62% of black girls in that age group. We got to do better. So here's a diagram of the HPV. Sexually transmitted HPV infections are common and often asymptomatic. Untreated cases in women are the main causes of cervical cancer. So you have the virus in the cervix. It enters the cell through microabrasion. So you can see it says infected cells. If you look right here, right? And then you go to several weeks later, HPV replicates, a sexually transmitted virus that causes cancer. More than 100 types of HPV have been found so far, and 90% of cases heal within 2 years. Then you go to step 3, 10 to 30 years later. 15 have been identified as putting women at high risk for cervical cancer. 3. 0.8% of cases develop cancer. HPV invades deeper lying of tissues and turn cancerous. So, like I said, we got to do better, ladies. And men, if you think women are the only ones who can actually catch human papilloma, I know you've seen them commercials. The CDC changed these recommendations in 2016. It now says only 2 doses are necessary for optimal protection in the patient if the patient is between 11 and 12, but 3 are still ideal if a patient is between 15 and 26. Timely pap smears are also wonderful and wonderfully effective at preventing full-blown cervical cancer. A pap smear would detect pre-invasive cervical cancer, but studies have shown women who are having pap smears may not get appropriate follow-ups. Several barriers exist for proper follow-ups, and African American women may be more vulnerable. So this is what a pap smear look like to you gentlemen that's actually watching this, because you want to learn about the woman's body. It's very important that we learn our women's bodies, because then we can have an understanding of what they go through during their lifetime. So if you look up, you got 1. Wait, hold on, right there. So they enter this tube inside the woman, and then you go to 2. So the device is open, and they inject a swab here, and then they twist it, right, and then they put it inside the container. That's they're gonna go test it or whatever. Another potential factor, though, may be racial disparities in cervical cancer treatment. A 2014 study published in PLOS One found that black women in Maryland were significantly less likely than white women to get surgery for cervical cancer instead of radiation or chemotherapy. Equivalent treatments are not being administered to white and black patients with cervical cancer in Maryland, the study author concludes. Differences in care may contribute to racial disparities in outcomes for women with cervical cancer. In 2016, the study in the Journal of OBGYN reached a similar conclusion. The study looked at more than 16,000 patients who have received care for advanced cervical cancer, finding that white women receive National Cancer Institute guidelines based care 58% of the time, black women 53% of the time, and Hispanic women 51.5% of the time. So in all actuality, it's not just black women who's suffering from cervical cancer, but also Hispanic, our brown brothers and sisters, our brown sisters, they are suffering at a high rate as well. So right now, I'm gonna give you some. I'm gonna give you guys some information on some of the causes, risks, and preventions. Okay, this is from American Cancer Society. Okay, let's go here. What causes cervical cancer? So, in recent years, there has been a lot of progress in understanding what happens in cells of the cervix when cancer develops. In addition, several risk factors have been identified that increases the odds that women might develop cervical cancer. The development of normal human cells mostly depends on the information containing in the cell DNA. DNA is the chemical in our cells that make up our genes, which control how our cells work. We look like our parents because they are a source of our DNA, but DNA's affects more than just how we look. Some genes control the cell grow, divide, and die. That's how it works. Genes that help cells grow, divide, and stay alive are called oncogenes. Genes that help keep cell growth under control or make cells die at the right time are called tumor suppressor genes. Cancers can be caused by DNA mutation gene defects that turn on oncogenes or turn off tumor suppressor genes. So, HPV, human papillomavirus, have two proteins known as E6 and E7, which turn off some tumor suppressor genes, such as the P53 and RB. This may allow the cell lining, the cervix, to grow too much and to develop change in additional genes, which in some cases can lead to cancer. But HPV is not the only cause of cervical cancer. Most women with HPV don't get cervical cancer. And other risk factors like smoking and HIV infection influence which women exposed to HPV are more likely to develop cervical cancer. So these are some of the things that causes cervical cancer and some of the risks. Y'all want to know? I'm gonna tell y'all what can actually prevent help prevent cervical cancer. So, can cervical cancer be prevented? The two most important things you can do to prevent cervical cancer are to get the HPV vaccine if you're eligible, and to be tested regularly according to the ACS, that's American Cancer Society guidelines. These can be found at the the American Cancer Society guideline for the prevention of early detection of cervical cancer. You can find this at the cancer.org and then search cervical cancer. The most common form of cervical cancer starts with precancerous changes, and there are ways to stop this from developing. The first way is to find and treat precancer before they become invasive cancers, and the second is to prevent the precancer. Finding cervical precancer, a well-proven way to prevent cervical cancer is to have screening tests. Screening is having tests to find conditions that may lead to cancers and can find precancer before they can turn into invasive cancer. The pap smear test or the pap test and the human papillomavirus test are specific tests used during screening for cervical cancer. These tests are done the same way a health professional uses a special tool to gently scrape or brush the cervix to remove cells for testing. If a precancer is found, it can be treated, keeping it from turning into cervical cancer. The HPV test looks for infections by high-risk types of HPV that are more likely to cause precancers and cancers of the cervix. There are certain HPV tests approved to be a primary HPV test and others approved to be as part of a co-test. So you have the option to do one or the other. The type you get most often depends on which test is available in your area. So if you live in an area that's more than likely lacking good health care, good doctors, physicians, gynecologists, then you probably won't be able to get the more advanced one. So I would say the code test is probably what you're gonna get. The pap test or smear is a procedure used to collect cells from the cervix so that they can be looked at closely in the lab to find cancer and precancer. It's important to know that most invasive cervical cancers are found in women who have not had regular pap tests. A pap test can be done during a pelvic exam, but not all pelvic exams include a pap test. So ladies, when you get to the doctors and you decide that you want to you decide that you want to actually have a pap test, just ask for one. It's not, it doesn't hurt to ask for one. This is your body. You want to be healthy. You want to live. You know what I'm saying? So you ask for what you need. A closed mouth don't get fed. The pap test or smear is a procedure used to collect cells from the cervix so that they can be looked at closely in a lab to find cancer and precancer. It is important to know that most invasive cervical cancers are found in women who have not had regular pap tests. I'm reading this again because I need to emphasize on how important it is to get a pap test. A pap test can be done during a pelvic exam, but not all pelvic exams include a pap test. The results of the HPV test, along with your past test results, determine your risk of developing cervical cancer. If the test is positive, this can mean more follow-ups, visits, etc. More tests to look for a precancer or cancer, and sometimes a procedure to treat any precancers that might be found. It is best to talk to your healthcare provider about your screening test results in more details to fully understand your risks of developing cervical cancer and the next steps. So, I'm just going to say things to do to prevent precancer and cancer. Get an HPV vaccine. The HPV vaccine of children between ages of 9 and 12, children and young adults between 13 and 26 who have not been vaccinated or who haven't gotten all their doses should get the vaccine as soon as possible. Vaccinations of young adults will not prevent as many cancers as vaccinations of children and teens. So the earlier you get it, the better you're off. The ACS does not recommend HPV vaccinations for persons older than 26. So if you're older than 26, please don't do it. It's important to know that no vaccine provides complete protection against all cancer, HPVs, so routine cervical cancer screenings is still needed. And if you need any more information, you can always go to for more information on the vaccine HPV, please see HPV vaccines in ACA or the American Cancer Society at cancer.org. Okay. Brothers, use a condom. Ladies, make sure if you have HPV, brothers, if you have HPV, please limit exposure to HPV. HPV is a transmitted disease, right? HPV is passed on from person to person during skin-to-skin contact. So if you have an infected area on your body and you touch someone, you can pass that on to that person. So just be very, very careful. HPV can spread during skin-to-skin contact, including vaginal, anal, and oral sex. Sex doesn't have to occur to be infected for it to spread. All that is needed is skin-to-skin with an area of the body infected with the human papillomavirus. This means that the virus can be spread without sex. So this is not a sexually transmitted disease. This is a transmitted disease that can happen during sex or just by touching someone. Okay? And smoking, don't smoke. Not smoking is another important way to reduce the risk of cervical precancer and cancers. I mean, it's so much information, guys. I mean, if you want to know anything about human papillomavirus, you can always go to cdc.gov. That's one big source for me. When it comes to cancer, you can go to the cancer.org website, search cancer, or you can also go to the Mayo Clinic. Mayo Clinic has a lot of important information, like what types of cervical cancer. You have the causes, when to see a doctor, symptoms. They got nice overview. Um, I mean, like, let me just throw this in here because I didn't talk about it. But symptoms, these, I mean, like, this is how dope. This is why I like the Mayo Clinic. Mayo Clinic gives you a lot, and it gives you symptoms, and some of the symptoms are early stage cervical cancer. Generally produces no signs or symptoms. So I did talk about that earlier. Signs and symptoms of more advanced cervical cancer includes vaginal bleeding after intercourse, between periods, or after menopause. Watery, bloody vaginal discharge that may be heavy and have a foul odor. Pelvic pain or pain during intercourse. So, ladies, if you're out there and you're having pain during intercourse, and I don't mean pain because you have a brother that's well endowed, but actually because it's painful, I'm going to need you to go see your doctor. Make an appointment with your doctor if you have any signs or symptoms that may concern you, because it's very important to catch it before it gets out of hand and then they have to do other things to you. You know what I mean? So let's do the precautionary as you know, let's do the precautionary as opposed to the post. You know what I mean? I mean, yo, I love you ladies, man. I know I'm talking about some things that, I shouldn't know about, or you would think that I wouldn't want to know about, but I want to know about these things, man. It's important that we know about these things, man, because again, like I said, when you're dealing with a woman, especially a woman that you love, your daughter, your mom, your sister, your wife, right? Shouldn't we as men understand the woman's body and the things that they go through? I say yes. But a lot of the times, you know, um, we don't pay attention. And I love my women. I love my black women with all my soul. So, with that being said, I'm going to keep it nice and short. I'm not going to talk too long because I can definitely do that. It's been about 20 minutes. Um, I'm going to say peace and love. Brothers, if you out there, love your black women. You know, love your black woman. Learn your black woman. Learn all the things that's going on with her so that you can understand her better, understand her more, you know? Because you know what? They understand us more than you think they do. And believe me when I say they understand us more than you think we do. We think we know, but we really don't even know the half. So love them, take care of them, cherish them, adore them, admire them, because these black women are everything and they will hold you down because they have that loyalty. Peace, love, talk life. Let's continue to talk life. I also want to say black equality movement has not gone anywhere. We're going to make this a reality because we don't have a choice. Once I'm done with this series, I'm going to be talking about some things that's going on in our society and it needs to really be spoken about. So, with that being said, God bless. Love is love. Peace.